I want to talk to you about a few quick things. One, there are some really harmful pieces of legislation that have led to the exacerbation of the problems and challenges with coronavirus. Now, many of you are looking to blame politicians. Go ahead and blame them. I think you ought to consider blaming yourself. I know it's harsh, right? Like it is, but you're the voter. You voted for politicians that brought about these things. There are three pieces of legislation that I want you to think about that have really harmed our country. One, the 1997 Balanced Budget Act. It capped the number of residency spots, AKA now the number of physicians. While many will argue that there's not a physician shortage, but there's a specialty and distribution shortage. To me, that's one and the same. While it's not technically the same, it's primarily the same problem. Like, i.e., if we had 5 times as many doctors today, everyone in the world would be happy, right? If the globe had 5 times as many. If in the United States we had 2, 3, 4 times as many, most people would be happy today, right? Number 2 piece of legislation. In the ACA in 2011, the United States government, along with the voters, eliminated physician ownership of hospitals. Is anyone out of their mind enough to say that physician ownership of hospitals in favor of insurance companies, private equity, and pension funds, it was a better idea? If you do, don't bother going to the hospital. Like, you shouldn't even bother. Financial folks have a wonderful place in this country. They do not belong in healthcare. They do not belong in healthcare. Government does not belong in healthcare. Physicians and highly trained clinicians belong in healthcare. And they ought to be in charge of healthcare. Not me, not you. Physicians, nurse practitioners, PAs, nurses who are the backbone of healthcare. They ought to be in charge. Now, the American people eliminated physician ownership. Do we really think that insurance companies and pension funds and private equity is a better owner and a better steward, more importantly, of healthcare? I think the answer is no. We should have never done that. I think that the American people were very jealous, particularly politicians, were very jealous. And they thought, well, you know what? Screw these guys. Screw these people that studied really, really hard for a long, long time. They don't deserve it. Well, guess what? We do wish they deserved it now, don't we? Third, certificate of need laws exist in 35 states. Thankfully, the state of North Carolina has temporarily lifted theirs. Certificate of need states are alive and well in places like Connecticut, New York, New Jersey. What does a certificate of need state do? Well, for reasons of patient safety, we reduce competition. So we could have had 2, 3, 4, 5 times as many hospitals, but we didn't. Because in order to build a hospital in any of the 35 states, you have to ask for permission. And the people who grant permission are the current hospital owners, the commercial carriers, and the physicians who are in charge of those particular hospitals. Now, my friends, listen. I'm not telling you this because I want you to feel bad. I want you to... What I really want is for voters to know what they're voting for. So while you're on the bandwagon of the blame game, which 99% of Americans like to do instead of looking at themselves, you might consider these 3 pieces of legislation and how they've created this perfect storm that we're walking into. I believe healthcare should be affordable and accessible to all on the globe. That is my belief, that's what I'm fighting for, and that's what I want. And I want you to know what's stopping that and the challenges that exist in the United States to a good profitable, and triple win type of healthcare relationship. I want healthcare to be affordable and accessible. And the only way I know how to do that is to make prices transparent, to make prices consumable and usable, and to create a system that's not owned by insurance, it's not owned by private equity, it's not owned by big hospitals. It's owned and managed by physicians and medical professionals alike. Rojas out.